everybody, and welcome to another Cape Conversations. I am in a very special place with a very special friend. That's right. The plastic Robert Redford is with me today. But I'm not interviewing him. I'm interviewing four great people, and we're going to have a great conversation all about Cape Cod Community College and all the things they're doing here. So come along. Let's have another Cape Conversation. Oh my gosh, where am I today? It is so exciting to be sitting here at the Cape Cod Community College, and I'll get the correct name because I don't have the correct name in my head, all about their new nursing facilities. And I am sitting with the two people that are most responsible for it, Marian Santos, and oh my gosh, the man himself.
I'm sorry, are you ill?
Dr. John Cox, how are you?
You know, you asked where are you? You're somewhere over the rainbow.
I am, and you're wearing the tie to prove it.
There you go. You're at Cape Cod Community College's new Nursing and Allied Health Center.
Wow. So what does that mean?
What does that mean? That means the community came together about a year ago, October of 2016, rallied around the interest of seeing us expand the number of positions we could offer our students. We're doing that by 32 over the next year and a half. We've expanded our agreements, our clinicals with Cape Cod Healthcare, working directly with them, providing our students that opportunity to have the experience in the hospitals and the Cape Cod Healthcare Network. We're expanding the employment opportunities for our students as well when they graduate, along with the ability to continue to earn their BSN through UMass Boston while taking their classes here at Cape Cod Community College.
How fabulous. And the lady sitting next to you, she just kind of hangs out here?
She's steering the ship.
She's steering the ship. She's the captain of the ship, she is.
I'm trying to be, I guess, with a lot of support from faculty here at the Cape Cod Community College.
Of course, of course. So tell me, Marian, what is this all about? I mean, are you a practicing nurse, or were you, or are you just one of those professors that never has done anything in nursing?
Well, basically, I've been a nurse for 33 years.
Oh my gosh.
I started out at Mass
You don't look
General.
old enough.
Oh, thank you. Thank you. It's the hair.
She started in elementary school.
No, I practiced for a long time in nursing, from med-surg nursing to psych nursing. And myself, I was a diploma nurse. So I came up the ranks and went back to school when I was 30 to get my bachelor's degree, and then at 47 to get my master's in nursing education.
Wonderful.
So I kind of know what it's like to start off, basically and work my way up through the ranks. And I think what's exciting is I came here a year ago, last September, and started to know another lab that was a lot smaller, I think, than this room, basically 3 classrooms that was functioning as a lab with some older equipment. And it is a nursing lab, but it's also a center for nursing and allied health. So not only do we do nursing, but we have a medical assisting program, a nursing assistant program, phlebotomy, and diagnostic tests. So we share this area with our colleagues.
I see.
And so when I came, I think it was 2 weeks in, we were charged with the nursing faculty with taking a look at what we'd like to see in a new lab, and with our colleagues from the other allied health areas, how we would like it. And we were really part of the architecture of how to develop this area and the design. Yeah, we worked closely.
So you had input in all
we had
of that.
a whole bunch of input.
Yeah,
that's
this
great.
is their design, working collaboratively with the folks from Cape Cod Healthcare. So as you look around, you see the similarities to what you would find.
Sure, if you were in a hospital that might have 4 or 6 or more beds in one room and what have you. Do you also teach trauma here too, in case if there's a trauma, if somebody comes in?
We're starting to put our simulations together right now.
see.
Now, the way we're situated, you can look through and you can see that we have 8-bed lab here.
Right.
And further on
And
down.
I love that you have patients that never leave.
We do. We have moderate fidelity mannequins that are here right now that
Is that
can
right?
actually breathe, and you can take a pulse, an apical pulse, blood pressure. We can run a small simulation with them. Behind us, when we look around, there is actually exam rooms.
Wow.
So that there can be an outpatient setting. Further on down, we have high fidelity simulators that we can actually code. We could actually do what you're saying as far as having a trauma go on with with the patient. And what I love about this is that students learn in a very safe area, that we can simulate real life situations, and they can become competent with high risk situations, and they don't harm a patient, and they feel safe to learn, safe to make a mistake. Being the nurse that's a little bit older and from a diploma school, some of the things that I learned was right on the job.
Yeah.
You know?
Sure.
Did you do this before? Yes. My dreams. I mean, they
Yeah.
actually have time to practice and learn
Right.
and become very competent.
Right. Which also would make a patient, when they're right out of the gate and they're in a real job, make the patient feel better that they have this confidence, so that they know that they're in good
Right.
hands. My daughter got her PhD in health strategies,
Okay.
nurses entrepreneurship.
Wow.
And she isn't currently, but she's a college professor now. But she worked with a lot of nurses, taking them and showing them that they should feel like they have, doctors are, some older doctors are a little iffy on it, but younger ones like the idea that nurses kind of take a step forward and really kind of work together and collaborate on things, which is, I think, a change from the old days, is what
Yes,
I'm
we're
hearing.
not sort of standing up anymore from
Right.
behind the desk and
Yeah.
offering our seats. I think it's really become a collaborative effort between the whole healthcare team. That
Sure.
it's not just the doctors kind of giving the orders, it's respiratory therapy, working with nursing, working
Right.
with dietary, and having a healthcare team for the betterment of the patient in bed.
That's
just
great.
exciting.
Oh yeah, it is exciting. So now, John, if I may call you John, not Dr.
may.
John. I could call you Dr.
Please,
John,
call
but
me.
then that sounds like the guy on the Muppets, Dr. John.
Dr. John. Okay. Well,
The
I
Muppets character.
can double as a Muppet
There we
character
go,
if you
there we
need
go.
to.
What made you do this? I mean, were you just sitting around your desk one day and saying, we've done airplanes.
He thought I'd
I thought,
enjoy
what can
this.
we-
I really
what
needed
can we
this in
do
my
for
life.
No, I mean, you've done airplanes.
No, well, we continue to do airplanes.
I know you do,
We're,
but
we're
what I'm
expanding
saying-
in that market too.
I understand that, but
it-
this is a whole new thing.
There's been some long-term engagement through the program advisory committees that we have going on. There's been a recognition of the needs here. I had a fairly extensive conversation with Michael Luff at Cape Cod
Sure.
Healthcare.
Yeah, yeah.
And we saw their need. They're looking at 70 nurses a year for the next decade, every year for 10 years. And they realize that if they want to make that goal, we really have to look internally on Cape Cod, our South Coast area. How can we grow that on our own? And we sort of scoped out a plan. Cape Cod Healthcare was first to step up to the plate. They put $1 million into this project.
Well, it's to their benefit.
Well, it's to the community's
Well,
benefit
it's to the
because they
communities.
don't, at the end of the
Yeah,
day,
yeah.
when we're unfortunately in that bed, depending on the nurses and the doctors and the healthcare workers, this is what gets us to that point, that we're actually addressing the needs that we have not only today, but as we progress into the future.
Well, I was wondering if, we are an older community, and we're aging quickly. I am myself
Really?
right here now.
Oh, tell me why. What's that?
And
You want to sit in
our
this
young
chair?
people
Yeah.
are going away.
Right.
So would this also might be a way to get some young people that have an interest in this field to stay? Of course, we have to find them
Yes.
housing. That's another issue.
Yes.
But
But
it
but
get them to
this
stay?
is a critical career that
Oh, sure.
has an income that you can live pretty well on Cape Cod. So that young people will stay. They see the career opportunities that are available, not only through Cape Cod Healthcare, but the other healthcare providers throughout the region. So I think this is an economic driver for our community as well as meeting the healthcare needs.
Have you told the Cape Cod Chamber of Commerce about this?
I have.
Excellent.
I have. I don't think you were at that meeting, or either that or
I wasn't. I don't know.
maybe
I
you were.
wasn't.
Yeah.
I think I was in Canada at that
Okay.
time. But,
Well, we'll let you off.
All right, let me off the hook. But you're right. I mean, now we all have to think about the economic impact of everything we do on the Cape because of our aging population, because of where we're situated. I mean, it's wonderful we're only 50 miles from Boston, but Isn't
We're
it better to
50
have it
miles
all?
from Boston.
You're
Yeah.
50
miles
miles.
from
Yeah, it's a
Boston.
challenge.
Right.
Well, and I think the
Here-
other
we have it
thing
here.
we don't talk about is that we want people to go into nursing because the nursing educator is also getting older. And
Sure.
we want well-prepared nurses to take the helm of becoming an educator.
Mm-hmm.
And so I think the average age, I was reading something about 47, 50 years old, and we have older educators, and we really want to mentor younger people going in and keep the cycle
Oh,
going
that's
too.
great. That's
You know,
wonderful.
so as we see this Bachelor of Nursing, Masters of Nursing Education, and really streamlining it to make it easy for the students to go from associate to bachelor's to master's.
And as we're here today, and we're going to look around this unit, if I can call it that, is that what it's called, a unit? It looks to me like the beds, everything looks like a real hospital.
It is.
It
It is.
looks like
In
a real
fact, when we
hospital.
ordered these beds, I talked to Cape Cod Healthcare and asked them what beds they used, and they used a little higher version of
Yeah.
Advanta beds. And we have head walls that work, that
Yeah.
have simulated oxygen, so they really get to use that when they're using it on a patient, on the simulated patient. So we really looked at what was used in the hospital and have similar IVs and similar
All of that.
equipment
Wow.
to that, so to what they're using when they see in clinical.
Now, when I first met you, I said you look familiar, and you do look familiar to me. I probably have seen you somewhere in Hyannis just walking down the street. I don't know, but you do look familiar. But you don't live here.
I don't.
You,
I
would you
don't.
commute every day?
I do. I
and
do.
And where do you live?
Martha's Vineyard.
On the vineyard.
I do.
Excellent.
Yes.
Well, you're commuting.
I have the
right
best of
way.
both worlds.
I was going to say.
In fact, I got closer because I did 5 years at Regis, but before that, I've always worked off island.
oh my
I have a
gosh.
husband that's going to stay on island. He's an optometrist, but I've
Okay.
always gone off. I have the best of both worlds.
I was going to say, must
Yeah.
be nice.
Yeah.
You get to come to the big city of Hyannis every day.
I do,
you go.
I do.
Do you
But I
go-
love to teach, and that's really the reason why. I had said to Dr. Cox before that it has been my dream to create a lab, and I
that's
have my
fabulous.
dream. So it's so exciting.
It is
It
exciting.
truly is. And it's like when you talk to the students, you'll be able to talk to them about the differences between our lab before and our lab now.
Sure.
And it's a huge difference.
And we are going to do that. So, what are your last thoughts about this? Where do you see this going, John?
I see this as the opener to a long-term engagement with Cape Cod Healthcare as we look at some of their needs moving ahead, opportunities that we can grow with them, as well as the other healthcare providers across the Cape and the South Coast. I would reiterate the piece about trying to engage students that or nurses that may come back a little bit later in life thinking about a career on the teaching side, how we can stimulate that thought and work towards filling that, both the need and the personal goal as well.
Sure.
But ultimately, it's what brings it all home is when you look at the students out there who are really taking advantage of the resources that the community has committed to. Because as you go through here today, what occurred here over the summer is the result of community support.
Wow.
It wasn't government support, it was the community rising up to help us address the need moving forward. So it says a lot about Cape Cod.
Well, it does. It does. And it's a need that's got to be filled, too. It really, really does. I want to thank you both for chatting with me because
pleasure.
I'm going to let you all go so we can look around and talk to a couple of students. Maybe you'll come back and show us some of the beds and all
Sure.
that, how that works. How about
Wonderful.
that?
Thank you.
All right.
All right. Thank you.
Thank
Nice
you.
to see you, John.
Always a pleasure.
Thank you
Always
so
nice
much.
to meet you.
Thanks.
Well, I am now sitting here with Holly, and it has nothing to do with the season.
It doesn't.
It doesn't.
No.
And Jermaine, that has nothing to do with the Jackson 5, but well, maybe a little bit.
Yes,
right?
my mom.
Maybe
There might be a
yes.
little story behind that.
Okay, so Holly and Jermaine, you're
Yes.
students here.
Yes, we are second year students.
Oh, that's so exciting. So, when do you graduate?
This May.
This
This
May.
May. Yes.
Can't wait.
Are you doing
Yes.
this or?
Well,
You're
I mean,
definitely
little
there's
this, a
certainly a
little
little bit
I
of
mean, my
this,
son
and
went
there's
to
a
school
lot of
for
this.
7 years, so the reason why I'm asking is I had a son in school in 7 years,
Yeah.
I kept saying, is this year going to graduate? Is it, so that's why I'm asking that question. But you're ready to get out of
We
here.
are ready.
You know what?
We are
Nursing
ready.
school is very fun, but it is not easy by any means.
No,
so.
it isn't.
Right.
And it shouldn't be.
No, it shouldn't
No
be,
one wants a
absolutely.
nurse that went through an easy program.
No, you could be funny,
Yeah.
but not having,
Yes.
too much fun
Yes.
like with your patients.
Right.
That would be true. So let's start with you, Holly. What
Yes.
made you do this? And are you from the Cape? Are you from off Cape?
I am from the Cape, born and raised.
Wow.
Born and raised,
Where
yes.
from?
Falmouth.
Falmouth. All right.
Falmouth, yep.
Excellent.
I got into this because I kind of fell into it. My father had health problems, and I went to the hospital one day, and it sounds really strange, but it felt like something clicked. It felt like home. It felt okay being there, and it was really interesting. And here I am.
And here you are.
And here I am.
And well, you started before this program was even available.
What do you mean?
I mean, the nursing program was here, but this wasn't
Yes.
here, was it?
Oh no! For our freshman year, this was completely different. Completely
This is
different.
a Ritz-Carlton compared to last year.
Yes,
Right?
we
Oh
were
my
in a
gosh,
Motel
that's great.
6 last
That's great.
year.
That's great. And Jermaine, what brought you to this?
My grandmother was a home health aide for the VNA for as long as I can remember. So I had interaction with healthcare very young. I chose to go to Upper Cape Tech and Bourne, and my teacher, Miss Dyatt, hi, love her to death. She is the biggest motivating factor for me doing this even now. Like, I graduated 20 years ago, but still, like, her voice is in the back of my head, pushing me to move forward and be successful at this.
Oh, that's wonderful. So you live here? You were born on the Cape or live here on the Cape?
I was born in Boston, but I've lived in Falmouth since I was 5.
Oh my gosh! So you're both Falmouth kids?
Yes.
Yeah.
Oh, excellent. Did you
Yeah.
know each other?
No.
No.
Excellent. So tell me now, what's the best thing about this program?
It's on Cape Cod, and it's a great resource. It really is. It's a great resource.
Yeah, I think being on Cape is definitely a big thing. I mean, there's not a lot here on Cape for people to do, so
True.
to actually have a community college where you can have a nursing program, I think is pretty amazing.
And what's the most fun thing you do with all these patients?
Here in the lab or
Yes.
at the hospital? Well, we
No,
can't tell you
you
all
don't
the
have
fun
fun with
stuff
it.
we have. Honestly,
So what do you do on these patients?
anything that we would do to a patient in the real hospital setting, but we're practicing it here in a safe environment, so that way if we do mess up, we're not putting the patient at risk. And a lot of times when you make a mistake,
Yeah.
you're not going to make that mistake again. So we're getting that mistake here, so that way when we're in the field,
Right.
we're actually not making the mistake on a patient.
So Holly, you do blood pressures on them.
We do blood pressures. We do blood draws off of central lines. Some of these mannequins, you can actually take blood right out of them. It's fantastic. You can listen to their lungs. You can assess these patients. It's about as close to a real patient as you can get.
And I noticed they're Caucasian patients. There's a black patient here. Do they have different needs because they're, or no? There's just,
Well, all of our patients are kind of transgendered.
Yeah.
They have
yeah.
different parts
Yeah.
to go with different lectures
Well,
and
that's
stuff like
what,
that.
yeah, that's what I was
Yeah,
wondering.
it's like, I don't know what kind of toy we had back in the day that we could relate to it, but they're interchangeable parts.
Yes,
Transformers.
exactly.
There you go, yeah.
Yes.
They're
Yes.
transformer patients.
Yeah.
I gotcha. So where do you want to take this when you're done with this? Where do you want to go? What do you want to do with it? Do you want to stay on the Cape? Do you want to go
Can
to
I
Boston?
answer for us?
Please.
We both really want the novice nurse program at Cape Cod Healthcare, whether it's Falmouth Hospital or Hyannis Hospital. We have talked about it, and it's something that we
Yes.
really want, because the novice
Absolutely.
nurse program gives you 6 months one-on-one with another nurse, really honing in on your skills, so that way when you're done with that 6 months, you feel really confident.
Yeah.
And now I'd ask the question of the others if they do anything with, bedside manner. You both are so charming that I'm sure bedside manner won't be a problem. But do you think about that? How you have to relate to people? Do they talk to you about that at all? Is there instruction?
Absolutely. He was in healthcare before he got into this program, but I wasn't. So for me, it was really starting from scratch, which you can do and feel safe and not embarrass yourself. And they teach you, go up to the patient, introduce yourself, and of course there's safety that comes with it too. You have to
Right.
identify the patient, but that way you don't go into the hospital and make a fool out of yourself trying to learn it there.
And what did you do in healthcare before?
I worked for the VNA, just like my grandmother, as a home health aide.
Oh my
I did a
gosh.
few other jobs with the VNA, but
Yeah.
yeah.
Oh, wonderful, wonderful. Did you like that?
Yeah, I love
And
it.
you went into people's homes, right?
Yes, home
Yeah.
care. Yeah.
Home care.
Yeah, hospice, all you name it.
Yeah.
I certainly was there.
So you have some background. You
I
come
do.
To that. You
yeah.
bring that
I
with
I
you.
tell everybody I have 20 years experience as a home health aide, and they look at me like I'm crazy because I look young. I'm not as young as I look, but I do. I have 20
Well, I
years.
know you secretly told me
you're
you're
like
75.
Mary, elaborate. Or you started in elementary
I
school.
know, right? But yeah, so I had 20 years experience
Yeah.
as a home health aide. So I have, first semester was a little bit easier for me than it was for somebody like Holly who doesn't have the medical background. It was a more smoother transition for me than her, but I shared my knowledge with people if they were
Absolutely.
receptive to it. I didn't
Yeah.
want to push my views on other people
Right,
because
right.
I'm not here to teach anybody. I'm here to learn.
Right,
But we all
right.
caught up quickly.
Yeah,
They made
absolutely.
sure. We
And
caught
you're
up
a work
quickly.
study.
I am the work study here in the lab.
Oh, that's great.
Mhm.
And what about you? You're
Not the work study. I work at Falmouth Hospital part-time. They came to the
Really?
program and they talked to us, and I got my foot in the door, so hopefully I get into the novice nurse program.
Excellent.
Yeah.
Excellent. And so you want to stay on the Cape?
Absolutely. This
You
is my
worry
home.
about finding a place to live or?
Well,
Oh,
I certainly
that's a-
do. I'm a single man, so
Right.
for me to have my own apartment, stuff like that, is a little bit more expensive. So
Right.
to be able to have a career,
And you'll make good money.
yes, to be able to have a
Yes.
career and be able to make
Yes.
money so that I can be independent is
That's
my actual reason for coming to nursing program is so that I can be an independent person and not have to rely on others like my parents to
Yes.
live with them or stuff like that.
Yes. of
Well, the reason why I'm
course.
asking these questions, I brought it up in the last little segment with John, is John and I are on a committee together at the Cape Cod Chamber of Commerce, but also I'm doing some work with Mashpee Commons. I used to work for them, and now I'm just working with
Well, I hear
them.
they got nice apartments in there.
They do. But they're also really looking at affordable housing because it's very scary. And the community of Mashpee, as they're doing all these big design things, they want to be able to house folks like you because they're worried about who's going to take care of them at Falmouth Hospital or
Yeah.
Cape Cod Hospital.
Absolutely.
Yeah. As they age. It's a serious problem here on the Cape.
Yes. No,
so
it
you are
definitely
so
is.
vital to our infrastructure.
It's true. Absolutely, yeah. I think while we're in school, it's hard trying to make a living and have housing that's
Yeah.
affordable. Hopefully, once we've graduated from this program
Right.
and get a good job, it won't be such an issue to find
Right.
affordable housing.
Right. Well, I didn't really get an answer about what's your very favorite thing about the program? Very, very most favorite thing you do during the day?
That we do.
Yeah, you are in this lab. What's the one favorite thing you just every day you come in you laugh, you kind of giggle to yourself, "Oh my gosh, this is so much fun."
Well, we have great professors that we work
Mm-hmm.
with. We have a great rapport with the professors, with the other students. But some of the procedures that we get to do with these mannequins, it's really interesting.
Yeah.
I can now say that I would be able to insert a nasogastric tube in a real life setting if I had to.
See?
It's
Who would
fun.
think of that? And how about you?
I just think I can't put my finger on like one specific thing. I think, but if we're talking about here in the lab, I certainly appreciate Marion's presence. She brings a calm, a sense of relaxation here that like you
Yes.
feel like you can mess up and like you're not going to be penalized for it. So I
Right.
feel like, and it's not just her. I think all the instructors do that well. But here in the lab, she's she's the head honcho. She's the
one.
boss. So
Yeah.
I think that is really important for us, and I really enjoy that because it makes this a learning experience and it makes it fun. It makes you want to be here and want to learn.
That's great. Well, when I get old and doddery and they take me to the hospital, I hope you two are my nurses.
You'll be in good hands.
We'd
We'll take
be
good
happy
care
to
of
help
you.
any way we can.
I love it. I love it. Thank you so much. It
Thank
was
you.
nice to meet
Yes,
both.
you
Nice to meet
too.
Nice to meet you. It was wonderful to have this conversation today here in the Center for Nursing and Allied Health. Wow, weren't Holly and Jermaine just fabulous? We are going to be in great shape as we age and are sitting in this bed, and they take care of us. Wonderful, wonderful young people, and so nice to meet. And Marion Santos, head of the program, and Dr. John Cox. Oh, wow. This is fabulous, and it's all right here on Cape Cod. And I'll see you next time for another Cape Conversation, but I am playing with Robert Redford's toes. Have a good one.